Àwọn aṣọ àyìndé ilé wa aṣọ àyìndé làwọn. Àti kọjá. Okay.
Yeah, son. I'm more like a son.
We put on mute, otherwise it's... Yeah, that's better. Too much of a disturbance.
He'd be muted for a bit. Yeah. Renuka, you have to start afresh.
Yeah, I'll start up afresh. We are meeting after a year again, and it's a pleasure to be on board with this symposium out here. I am a breast cancer survivor of, since 1997, so that would be over 23 years this year. And it's been, I'm happily married with a husband with me and children who are married and 4 grandchildren ranging between 14 and 20 years old. So I've seen life over a period of time, and I've seen life after cancer about nearly 20 odd years now. And I feel really blessed to have been given this opportunity by the Almighty to be able to get back to society what I received from the society which I am working in right now. And for me, it was like a call that came in, the diagnosis of cancer. At that moment, of course, it was devastating. But in hindsight today, I think it was a call that I had from above to say that I think you need to spend some time giving back to humanity and to society what they have given to you. So I have been working, and that's it. I'm now presently the Honorary Secretary of the Indian Cancer Society.
Thank you, Renuka. Can we have Catherine Ngaraku? Introduce yourself, Catherine, please.
Yeah. Okay, hi, good afternoon from my end. Catherine Garashu from Kenya, Nairobi. I'm based in Nairobi. And I am a breast cancer warrior, 16 years in January, turned 16 years in January this year. And yeah, I'm a Reach for Recovery volunteer and also a trainer. I train Reach for Recovery volunteers here. And I do, and also a global hero of hope for Relay for Life, 2017, 2018. And I do a lot of advocacy, create awareness, and yeah, visit ladies who have been newly diagnosed with breast cancer. I am married, sorry, and one daughter.
Thank you, Catherine. Can we have John Jetta Zika? John Jetta Zika, please, can you introduce yourself?
Hello, everybody from Europe. I'm Donieta, and I'm from Padona, Albania, from Albania. I'm not a survivor, but I'm a patient advocate. My mom and 6 other family members are also survivors. My aunt has 18 years that she's a survivor, and my mom has 10 years that is a survivor. I'm engaged with Europadon Albania, is focused only on breast cancer, and we are doing a hard job these times, and hope you are all well in these difficult times for everybody of us.
Thank you, Don Jetta. Can we have Dr. Ekusami introduce himself, please?
Hi. Hello.
Hello, hello.
Hi, Dr.
Okay. Okay, Dr. Ekusami, my first name is Dele. Everybody calls me Dr. E. Yeah. I practice internal medicine and oncology in Rock Hill, South Carolina. And myself, I'm a cancer survivor. I had prostate cancer 2011, and I'm completely okay. There is nothing else I need to say other than I got a beautiful wife and 3 lovely children, and everybody here is doing great. Thank you very much.
Thank you, Dr. Ekosami. You're welcome. Dr. Ololade.
Hi.
Dr. Ololade, please.
Yeah, Dr. Ololade here.
Doctor.
How are you? I'm Dr.
Very well,
Ololade
thank you.
Kennedy. So I'm Dr. Ololade Kennedy. I apparently, I'm an oncologist, and I've been in cancer care since help a lot of people through from diagnosis, through the investigation, through treatment, and also watch a lot of people survive, and some people unfortunately do not. So, I'm here to contribute to this wonderful symposium and to celebrate survivors from having recovered from all the tears and all the challenges of cancer care. Thank you.
Thank you very much, Dr. Ololade, and thank you everyone for coming in and joining us in this symposium. The next, we're going to move on to the cancer survivors sharing their stories, their life story with us. The first person that will be called to share our story is Dr. Share your cancer story with us. Tell us a bit about life after. Thank you.
All right, can you all,
Dr. Chika, you need to unmute.
can you hear me now?
We can hear you now.
All right, so
We can hear you now.
I was diagnosed with breast cancer in 2010. At that time, I felt like my life was rudely interrupted because I didn't see it coming. I was a nursing student at that time, a mother of 4 children, and like everyone who's had that experience, I remember that time. You never forget the call, and I say I didn't see it coming because when my doctor, Jacqueline Walters, encouraged me to go for a mammogram, I was only 36. I was 36. There was no family history of breast cancer in my family at that time. And I thought it was a joke. But because she's a 2-time breast cancer survivor, she is proactive and advocate. So I decided to it was supposed to be a joke that I actually went to the mammogram. So after the initial mammogram, they called me back for the diagnostic mammogram. So when she now called me later on, like I think 3-4 days later, to tell me that I had breast cancer, I was devastated, a mother, wife, thinking about, your children. I mean, it's like at that time, your mortality, you're faced with your mortality, like, am I gonna die? Am I gonna make it? So I went on and I was very proactive in the sense that it was BCIS, it was stage 1. That's why I'm a big proponent of early detection, because early detection saved my life. And that's why my nonprofit is focused on, women empowerment education to make breast health priority, to make sure they can find it early, because early detection helps in diagnosis and treatment. So I had options to do a lumpectomy or mastectomy. I made the radical decision to do a double mastectomy at that time with reconstruction. It was a difficult journey for me because I was a student, a mother, I had a lot of responsibilities, but because of my belief system in God, a strong family support system, I was able to go through this time of pain and despair, with the foundation and the love and support. And 5 years later, I started my nonprofit and turned my pain into purpose. and to be proactive. I was actually discharged by my oncologist, but I'm like, I need to make sure, you know, that I'm okay. I don't want a situation years later, they say, oh, I tried to reduce my chances to 0. You know, they tell you 0.00 point, all these percentages, but I stay proactive. I get my wellness check. I get my scans yearly. Then life after breast cancer, I'm living a wonderful life. I went back to school and got my doctorate degree. I'm a psychiatric nurse practitioner. So for my nonprofit, I help empower women to make breast health priority. But for my professional life, I treat people with depression, anxiety, PTSD, schizophrenia, bipolar. And, you know, I'm all about education because there's so much power when people are educated and understand the dynamics. You know, it makes a world of difference. Education so much that for my doctorate degree, my project was the effect of mammography education on African American women. And it was wonderful to see what I already knew, that the more women were educated on breast cancer and getting their mammograms on time, it reduced the mortality rate because their cancer was found early. So I am blessed. I'm glad that I, you know, with support, I've been able to change my journey of pain into a place of purpose where I can be part of a symposium like this and, you know, teaching women globally to stay proactive. So thank you so much.
Thank you very much, Dr. Chika, and thanks for sharing your life journey. Would you want to tell us a little? You've got 2 more minutes. Would you want to tell us a little bit about your life after?
So life after breast cancer, I went to get my doctorate degree. I have my nonprofit, and every year we do a walk. You know, we do breast cancer awareness walk. It takes place here in the States, in England, in Lagos, Nigeria, different states, Atlanta, California, Dallas, Houston, and women come out. You know, women come out and we encourage them, we educate them to get their mammograms on time. After breast cancer also, I started a YouTube channel where I do educational videos, you know, also teaching women how to do their breast exams monthly, how to, you know, identify their risk factors, how to keep up with their doctor's appointments, and also providing resources. We, you know, had programs where we were, you know, paying for people to get mammograms done. And we've partnered with different organizations like TINUS and other ones in Nigeria to help with, you know, not just teaching materials, help with getting women their mammograms, and so in some cases, treatment. So it's been a wonderful journey and still on that journey. And I'm very, very happy that I'm here today. Thank you.
Thank you very much, Dr. Chika. And I would like to let everyone know that we are preparing to go live on Facebook. So more people will be able to see us, but they will be able to ask questions. So the next speaker now will be, Catherine Ngarachu. Catherine, please, you've got 7 minutes. Can you tell us about your diagnosis and life after? Thank you. Can you hear me, Catherine? Hello, Catherine, can you hear me? Yes.
Okay,
yes.
yeah, now I can, because I couldn't unmute myself. Okay, so my journey started in 2004. And I had learned how to do breast self-examination. That's why I really, really advocate for and show a lot of women how to do breast self-examinations. So I always did my breast self-examinations every month. And that's where I felt the lump. And for me, there was no one in my family who had, we don't have a case history where there is cancer in my family. So of course I went through the process of having the test done, had a mammogram done, had a FNA done, then eventually had the lump removed. And so when the results came out because the FNA was inconclusive, so they decided, let them remove the lump, and then that's when the lump was tested and it came out positive. So with the doctors, you know, they asked me and I just told them, you know what, I don't need that breast, just remove it. Yeah, so I had a complete mastectomy done. And yeah, then I started my journey of treatment, which I had all the chemotherapy, all the radiotherapy treatments. And the irony of all this is that when I was diagnosed, my husband, his mother died of breast cancer in the early 70s. That time, you know, not many people knew about breast cancer. And then in 1989, there are 3 in the family. He's the second born. And then his last born sister was diagnosed with breast cancer in 1988. And even that, we didn't know. We used to joke around and say, you're getting a 3rd breast, you know. So, but unfortunately, in 1989, she passed on because they only removed the lump. They only did radiotherapy. And that time, the only hospital that could do that was here in Nairobi, Kenyatta National Hospital. So when I was diagnosed, I was like, man, this is not, you know, God really, why are you punishing this man? You know? So for me, I actually thought, even the day I was going into hospital, I wrote a note, put it on the pillow, so that when he goes home to sleep in the evening and, you know, he reads it, and I told him, you know what, I will understand if you're not able to take all this in, you know, from your mom to your sister, and then now me, I will understand. If you want to let go, it's okay to let go. The following day, he brought me that note in the hospital and told me to tear it up and never to write such a note. I thank God for him. He's my pillar. He's been supporting me throughout. So all the work that I do now, actually after the treatments and all that, because I basically went through the treatment, not meeting anybody else who had undergone any cancer treatment. And mine was also early stage. And so I, you know, at the back of my mind, I'd always said, I do not want any other lady to go through what I went through, you know, not being able to talk to anybody about what you're feeling. You can talk to your relatives and who have you, but if somebody has not gone through what you have gone through, there's no way they can understand, you know, what the pain or your feelings. So then after that, that's when I came across Reach for Recovery International, and I joined and was trained as a Reach for Recovery volunteer. And that's the work I do now. We walk the walk with newly diagnosed women and even follow up even after their treatments. And yeah, and I do a lot of volunteering at the hospitals during the month of October when they're doing the screening. So we have these dummy boobs that we show ladies how to do breast self-examination and how to feel for the lumps. So we do a lot of that. And I'm part of the Relay for Life team, organizing team here. And yeah, due to the work that, you know, we do, Relay normally nominates people who are done much for the society. So that's how come I'm a global hero of hope. We are many of us, and yes. And life after cancer, gosh, you become new, you start thinking differently, completely. And yeah, I look at life in a different way from before I was diagnosed. So I don't take things for granted. Yeah, that's me.
Thank you very much, Catherine. That's a very passionate one. Compassionate one. Thank you so much. So the next speaker will be Renuka Prasad. Renuka, you have the floor.
Yeah, good to be here with you. And let me just tell you at the start itself, you are having the Cancer Survivors Day today. We in India celebrate it in the 2nd February, in the 2nd Saturday of February every year. And that for us is again a celebration of life, one of joy and fun. And we all have a lovely time dancing together and celebrating it together. So for me, my tryst with cancer, it began 2 decades ago in 1997, when I was diagnosed for breast cancer. And the usual reaction, which the earlier 2 speakers have also said, devastation, you feel it's the end of life, there's nothing to look forward to. And now it's just that you're either going, gone. You know, you're almost there. But yet, that spirit is there in you, and you do want to fight it because you do want to survive. And survival is the best thing that you look forward to, because you have to survive to be able to live in this world. You have a husband, you have a carrying family, you have children. You do not want to just go away at the drop of a hat with this breast cancer. So, but there was no running away. So it was the normal, regular course of action that follows: surgery, radical mastectomy, chemotherapy, followed by hormonal therapy. And it was actually by chance, that I had found my own pea-sized lump in my left quadrant of the breast. And that is where one feels that being aware of your breast, early detection, is really the keynote. So I was advised a mammogram followed by an FNAC, after which there was a confirmation that it is a malignancy. The surgical oncologist suggested a modified radical mastectomy, wherein the entire breast would be removed along with the lymph nodes in the armpits, saving the body wall. He felt this is the best way to be able to get rid of, even though the lump was a small one. It wasn't a very large one, and the lymph nodes had also not been infected. But he felt this is the best way, we have to fight it. And for a patient, not only me, for everyone else, you put your hands into the doctor's hands, and he for you is the God for the moment. He's the one who's your best judge. So you go along with that and go with the flow and just let it take you over. And that's how I had my mastectomy. Recovery afterwards was quick, but thereafter the chemotherapy and the drugs administered were based on the histopathological report, which is with everyone, as also the oncologists here would know. But since the lump was small and it was contained, and I was not given a very aggressive dose, so I did not lose my hair, which is one of the biggest fears that anyone undergoing chemotherapy had. But yes, my hair thinned a lot, and I'm grateful to God for these small mercies. Ever since I was diagnosed, my prayers to the God Almighty were only one, and I'm a firm believer of the God, the unknown power that is behind this universe, leading us through all this together. That look, you've given me this problem, and now only you have to give me the strength to be able to fight it, cope with it, and come out victorious. There's no point in my moaning and groaning over the fact. I just have to fight it, and I have to fight it with all the positivity that's there within me. And I remember at that moment itself, a quote by the Dalai Lama, who had said there are only 2 days in the year that nothing can be done. One is called yesterday, and the other is tomorrow. So today is the right day to love, believe, and above all, live. So keeping this dictum in mind, I realized the positive attitude was really necessary for me to deal with the today that I was facing, and which was really staring at me. So I won't say it was an easy experience. 16 sessions of chemotherapy were quite weakening, but the resolve in me to get better and to get out of it without any problem was very, very prominent. And that is what saw me through this. But then once the hormonal therapy started, I didn't realize, it had no side effects at that moment. But today I'm living with those side effects, whether it is my diabetes, whether it is the hypertension, whether it is the osteoporosis, or any other little ailments that one keeps getting, the anxieties and things like that, all related with the hormonal therapy. But like they say, with every calamity, there is always a positivity, the other side that comes your way. And for me too, this held true. While I was being diagnosed, after having undergone my surgery, the biggest problem was seeing that scar there, that, horrible scar which was there, facing that was a big challenge. And I was really in tears. I don't know how emotionally distraught I was with that. And it was one of the volunteers from the Indian Cancer Society who came, met me, reassured me that it's not going to be a problem. There is something called a prosthesis, and your body image will be back to what it was without anybody knowing it, but you yourself knowing it. And you have to come to terms with that scar out there. Live with it, get used to it, feel it, and after a time, it will just disappear. Well, that's exactly what happened. I got used to it. I had no problem at home. My husband gave me all the positivity that he could give me. He was there holding my hand all throughout, never pushing me through at any time. And after having seen the way this volunteer helped me through this difficult phase of my life, that really emotionally traumatic phase, I decided that I just have to do something and get back to helping women to come forth with an early detection of the cancer and not leave it in the late stage, because in our country, we do see that very few women come in at the lower stages, at the stage 1 or the stage 2. It's generally 70% of them who come in with stage 3 or stage 4, which is the advanced stage they come in, which can lead to metastasis also and become an MVC, where there is no cure. You just have to live with it. There's no other way out. So the advice is to everyone to come. That is why I joined up Indian Cancer Society, because I felt this is an organization that is doing so much for the women. For the women, we want them to realize that how important it is to come with early detection. After early detection, because of the size being small, it's curable. And there is a life after cancer. And all of us standing here, sitting here, are living proofs of it. Similarly, in the organization also, which comprises basically of the breast cancer area of the women who have undergone breast cancer. And they are surviving, and they are fit, and they are living a wonderful life after cancer, just as I am doing right now. So keeping this in mind, going back to what is life after cancer now. Life after cancer for me is a full-time devotion to this cause. And this is a cause that is going to stay with me till I'm around. I want to give my 100% to whatever I can. And for me, it's become a vocation. It's like God chose me for this vocation. And I'm here in this field, helping people. One of the best things that I feel I have been able to do is to try and get every woman within the Indian Cancer Society, is what we give out, are breast bras and prostheses. These prostheses are so welcomed by the women all over Delhi and the National Capital Region. We get queries from all over the world. And today, we are also getting some of the silicone ones which are coming to us from England, kind courtesy of a friend who is there and who discovered us and realized the kind of work that we are doing in this field. So this is an important facet. We do a lot of that. Right. Thanks. And I'd like to just mention here also one, that fundraising is a very important aspect for us. Organizing events, getting those things, because without money, as you know, nothing works. You have to have the money to do it. Thank you.
That's it. Thank you, Renuka, for sharing your story. Dr. Dele Ekusami, would you like to share your story with us before I come on? You need to unmute yourself. You need to unmute yourself.
Yes, I would rather I would rather talk on answering questions from patients, and I will casually mention my situation during that time.
Okay. Okay. So do I go first now, or you would go first?
You go.
Would you want me to go first, or you go first?
You go first.
Okay, thank you. Thank you, everyone, and thank you for joining this symposium once again. 6 years ago, when I was diagnosed, little did I know that I'll be here talking to you, facing you today, and sharing my story. This was at a time when Ebola was in Nigeria, and when everybody was afraid to even go near the hospital because the first case of Ebola in Nigeria was found in the hospital. Incidentally, I was home that day. I don't check myself, and it was, it was lumpy. So I decided not to touch it again because it was scary. I knew that, I've always known that cancers grow from lumps. That was all I knew about cancer at that time. So I gave it about 3 days, believing that it would fizzle out or it will disappear on its own. Unfortunately, it did not. By the 3rd day, I picked up Google and I Googled breast lump. Google told me that breast lump was could be cancerous and it could be non-cancerous. I decided to choose the non-cancerous because I would rather my breast, I would rather be non-cancerous. But unfortunately, the lump did not disappear. It took me about another 3 months before I could come to terms with trying to do something about it. Then I went to the only doctor that I knew at that time, who was the doctor that delivers my babies. As at that time, I think my last baby was about 12 years. And normally I don't fall ill. I don't fall sick at all. I'm not someone who gets ill at all. So for me, it was the last thing I wanted to hear. He checked it and he said, well, that I could also feel a lump and then that he would advise that I do a mammogram. I did a mammogram at that time, and mammogram said, the guy that did the mammogram and also did the breast scan. He kept checking and checking and checking. At the end of the day, the result came out and the mammogram said it was benign. So I was happy that it couldn't have been anything else. Lucky at this time that I went to the hospital, Nigeria had been certified free of Ebola. And that was the only reason why I went to the hospital. I wasn't going to go to the hospital and get myself into another mess, So by the time the result came out, I felt happy, but the doctor said to me that I should make sure that I remove it, which was a lumpectomy. So I looked for I met someone, a nurse, who introduced me to somebody that was supposed to be a surgeon. And my thought was we were going to have a meeting. And once we have a meeting, he will explain to me what exactly is going on, and then we'll remove it and all that. But incidentally, I got there, and it was a very fast thing. It was impromptu. I wasn't even told. They told me they had prepared the theater, that they were ready for me to do a lumpectomy. Anyway, I did the lumpectomy, and the result came out. By the time the result came out, it became cancerous. And I was wondering what happened. If my mammogram said it was non-cancerous, why should it now be cancerous? So that really disorganized me so much. I had to go challenge the pathologist that did the test. I told him that the result was not mine, and he couldn't have given me that kind of result. I didn't have cancer. I couldn't understand where the result was coming from. But this guy told me that day that he was particularly interested in my result because it's an unusual kind of cancer. It was called medullary carcinoma. And that he had to call some of his students to come and see what they had read about back in school. And it was very, very short. Of course, this really got me scattered and I was depressed. But I decided that no doctor was going to touch me because at that time I was living in denial. I failed to believe that I was cancerous. And then I didn't want anyone in Nigeria. I just believed that Nigeria didn't have doctors or they didn't have oncologists at the time that it happened. So I went back to the surgeon that removed the lump, and the next thing he told me was not, it was not palatable to my hair. So I decided to leave, and I wasn't going to do anything about it. I went on for about 6 months. I was depressed. I wasn't talking to anybody. I wasn't, but after a while I decided to get out of it. And I told myself that whatever will be, will be. And I ended up, I made up my mind to enjoy myself, have parties, go to parties, and just put it off my mind. But as God would have it, exactly a year after I removed the lump without any treatment, this lump grew back in the same spot. At this point, it was even getting bigger than how it was before. And I knew that I had to travel abroad. I did everything possible to travel abroad, but somehow I couldn't get a visa. Eventually, God led me to my doctor, late Professor Ajeki. It was this doctor that convinced me to go for treatment, and started treatment at Luz. And we started this treatment, and before the end of 8 months, I was done with my treatment. In between this time, because I said I don't fall ill, I was able to see all the ills in our hospitals. In the Lagos University teaching hospitals, I realized that we didn't have so much equipment to treat cancer in Nigeria. In Nigeria at that time, we only had one radiotherapy machine working in the whole of Nigeria. We had 8, but 7 of them had packed up. So everybody was coming to Luz to use their radiotherapy machine. Fast forward, today, after the whole thing, these were the things that led me into starting a foundation, trying to find a way we can do something about the health sector in Nigeria, especially concerning cancer. So I started to advocate. I came online, I came on TV, I came on radio, I went in the newspaper because I have a media background, and I decided to share my story with the world. At that point, I knew that my messages would get to the right authorities. Luckily for me, I got the attention of the media, I got the attention of people that are interested, people who have lost people to cancer, and we started it from there. And to the glory be to God, today we are standing tall, and we have done so much, we have impacted so much lives and all. I want to say to everyone out there that early detection is very key. Cancer is a no respecter of no one. Cancer does not know the man, it doesn't know the woman, it doesn't know the poor, it doesn't know the rich, it doesn't know the tall, it doesn't know the short, it doesn't know the thin, fat, it doesn't know no status or race. So please ensure that you check yourself from time to time. It's a good thing now that we are beginning to have equipment in Nigeria, but I pray that we have a complete cancer center in Nigeria. We have radiotherapy machines in different university teaching hospitals now. We have about 3 in Luz now, and we have in some other university teaching hospitals. So we're grateful to God. We know we'll get there. We're not yet there, but we know we'll get there. So I want to encourage someone today, to all my fellow cancer survivors, I want to say congratulations. To all the angels that we have lost, I want to say we honor you, and we pray that may your soul rest in perfect peace. We won't stop this fight against cancer. We'll continue to share the message. Thank you. So to you now, Dr. Ekusami, we would like to hear you talk about prostate cancer. Can you please educate us on prostate cancer, please? You've got 7 minutes, sir.
Okay. Have a good morning and good afternoon in Lagos. Prostate cancer is a glandular tumor of the prostate gland. And the prostate gland is a gland that is below the deep layers, the inner layers of the penis, surrounds the penis. And The prostate gland, what does it do? It collects seminal fluid and mixes it with some semen, and before it's gotten into the during sexual intercourse. Sometimes in the lifespan of man, the prostate gland becomes big, which is the commonest thing that happens to it. That is not cancer. We call that benign prostatic hyperplasia. But as men grow older, some of them will develop prostate cancer. There is a saying in oncology that says that if you grow older enough, you are going to develop prostate cancer. As a matter of fact, postmortem done in men who are over 90 years old, a long time ago, showed a good number of them has had prostate cancer. But why is this topic very important? It's important to men, women, everybody, because an average woman either has a boyfriend or a dad or a husband, and all these people have prostate. The prostate might develop cancer at some point. And how do you know? Men are very stubborn. It takes them a long time to complain about anything. So if you see your man going to the bathroom too frequently at night, you have to send him to the doctor, because we call that nocturia. That is not the only thing that causes nocturia. If you have diabetes, you will also have that. If you drink too much alcohol in the evening, you will also have that. But if your man is older than 50 years old and is waking up many times at bedtime after he goes to bed, then goes back again, he needs to go check his prostate. There's something called hesitancy. Your man gets to the bathroom. He wants to pee, but he cannot. The pee doesn't come out. Everybody comes and leaves him there, especially let's say you go for a game at the stadium. If you see a guy who stays there and doesn't come out, he has what is called hesitancy. It takes a while for the urine to come out. And when it comes out, he stops, and then he has to push again to get it out. That is one of the problems of presentation. If the men are the types that don't complain, they might have the late stage problems, like having pain when they pee because they already have infection with it, or they have pain in their bone because of metastatic disease, or they have pain everywhere, or they cannot eat, or they have anorexia. But the commonest presentation will be urinary frequency, hesitancy, which is otherwise known as prostatism. Now, the risk factors for prostate cancer is not a lot. We really don't know why it happens. However, you know, fatty food is mentioned in virtually every cancer. So in oncology, we think that if you eat a lot of fat, you have an increased risk. There are some studies in oncology that says that if you have one family member with prostate cancer, you have an increased risk. And if you have two, your risk increases, is doubles. In the United States, black men have more cancer of the prostate than white men, other groups. So, and prostate cancer is the second leading cause of cancer mortality in the United States, and is the sixth cause of cancer mortality in the general population. However, the good news is this: if you find out about your cancer early and you get it treated quickly, the mortality is not as bad. In the United States, for instance, 5-year mortality is 100%. And that is for early stage disease. For late stage disease, it's about 30%. So the purpose of this talk is education, education, education. And let us educate our listeners here and everybody that tell your men to check their prostate. If in my office, we check any guy, any black male who comes in. It's not universally accepted, but we check every black male who comes in at the age of 40. We check them for PSA. PSA elevation does not mean you have prostate cancer, but you can quickly catch it. And that is where I will come on to talk about my own personal experience. I'm a cancer survivor too. In 2011, I just said, let me check my prostate. I was 49, I believe. What happened was my usual number, I have always checked it. The usual number went up from 1.3 to 1.9. And like everybody else, I was a little more worried than usual. I called my urologist friend. He said, listen, Dele, don't create problems. You have nothing. I'm going to give you some antibiotics. Maybe you have prostatitis. We did that. He did not go down. He went down by 0.1. So I said, let's do it again. We did it. It was 2 point something. That's about 6 months to 1 year later. And then I said, we have to biopsy. I was very aggressive with it. And we did a biopsy. It was negative. You know, I said, listen, Terry, we have to do another one. We did another one, 12 biopsies, and it was negative. And I said, okay, let's give it the last chance. Let's do one more. And we did one more, and it came out, one of it was positive. So I had radical prostatectomy because I was a young man. I had a wife. I have a wife and I have children. And I told him, listen, man, you have to keep my manhood. So that's why I did radical prostatectomy. And he did. He did everything perfectly. And I don't have any side effects, no urinary symptoms. Manhood is great. Everything is fine. So I want to let everybody know that this thing, if you get it early and quickly, you can be very, very well taken care of and you can be okay. I will answer other questions during the question and answer sections. Thank you very much.
Thank you very much, Dr. Ekusami. Thank you for sharing your story and thank you for educating us. But we're moving on to Dr. Ololade Kehinde now, who is going to be discussing acceptance and cervical cancer with us. Dr. Ololade Kehinde, you have the floor, sir.
Good afternoon, ladies and gentlemen.
Good afternoon, doctor. We can hear you.
Am I audible?
Please go ahead.
Yes, please.
Yes,
So apparently, one of the things I've realized and I've been a challenge in cancers that I've come across is that cuts across everyone. It's normally the circle between acceptance of the diagnosis to going through the test, then to the denial phase, to the depression phase, and to the mood swings that normally occur. And some people even go to the point of aggression. And some people even give up and want to start selling their properties and want to not be involved in a lot of social activities. And because of that, we've realized that as much as possible, people should, we encourage people that whenever they are going through cancer, it's not the time for them to be alone. It's not the time for them not to be able to, it's not the time for them to be, to just go through it solitary. They should have a very firm support system. They know what works for them. Some are very good with the church groups. some are good with their families, with their friends, some are good with their relatives, and some are even good with their partners. So, and also there's, apart from them individually being involved with the cancer, it also involves the support structure. And we know that cancer management is a long marathon. It's not just a day thing. It's something that takes place, I mean, and all that. So the earlier we accept it, the better it is. Because we've also observed that people that present early, they do very well. Majority of the survivors are those that accepted their diagnosis and sought for appropriate medical care as early as possible. Now, coming from that is the short discussion about cervical cancer, which is just that one of the early things, you know, because cervical cancer is really very common, particularly in the sub-Saharan African region, and in areas where people have a large number of children. Once they have more than 4 or 5 pregnancies, people that have multiple sexual partners, people that have under one form of sexual habits and all that. So, and we want every lady to be aware of those early signs. One of the early signs is the fact that when they have coitus, or when they sleep with their partners, they notice that they see blood. And one of the things also is that some people can have post-menopausal vaginal discharge, of post-menopausal bleeding. And as much as possible, people that encounter that should, as much as possible, ensure that whenever they have such challenges and such complaints, they should see their doctor appropriately. And you know, the doctors will be able to help them, to be able to guide them through the process. And also they shouldn't keep quiet at that point in time. If for one reason or the other they do not know the approach, there's so many NGOs like this particular NGO which is able to support them through the process. There's really nothing new in the world. People that have cancers, some other people would have had cancers before, and there have been people that they've been able to, their testimonies they can share. And also there's some support groups, like cancer support groups, cervical cancer support groups, breast cancer support groups that individuals can go through. And as much as possible, when they do that, they will be able to pass through the process, and they will not be victims of either neglect or misdiagnosis and all that. Because one of the challenges also about acceptance is the fact that majority of our cases and majority of our patients, they see a myriad of people. Some see the pastors, some will see the traditionalists, some will see the cultural people, or even the herbalists, and they profile different solutions for the same problem. So that as much as possible, we always encourage those that are involved that they should not just throw caution to the winds and all that. Then as much as possible, if people accept and they present early, they do better. Thank you very much.
Thank you very much, Dr. Ololade, and thank you for educating us on cervical cancer and acceptance. Thank you very much. The next, but I think she's having a problem with her internet. She just sent me a message that she's going to join us in a short time. She's having a problem with her internet. We know that Catherine can talk to us about patient navigating. Am I right, Catherine? That's it. Hello, Catherine, can you hear me? You need to unmute yourself.
Yeah,
okay.
I've unmuted.
Can you talk to us about patient navigating?
Okay.
Thank you.
Where
can I use myself? Sure. Where is your connection? She meeting online.
Can I talk now?
Where is your connection?
Can I go ahead?
Catherine, go ahead.
Okay. We have a program with the Kenya Cancer Association whereby one of the programs that they run is patients navigation, which is based at the program with the Kenya Cancer Association, and this is together with the Kenyatta National Hospital, whereby we have nurses who have been trained, and when somebody goes to, you're told to go to the cancer, center or department, you don't know your way around because it's such a huge hospital. So they have somebody who guides them along to which department to go to, which doctor to go and see. So that is being done with by the Kenya Cancer Association, and yeah, that's one of the programs. So they've had people trained there. They're like the nurses and some of the workers there at the cancer center. So in case somebody, you go there, you don't know which way to turn, where the radiotherapy treatment center is, or the chemotherapy room is, there are those people who will guide you along.
Thank you, Catherine. Thank you very much for educating us on that. The next, mute all the attendees. In case you want to, please ask your questions now. Let's hear your questions. Just raise your hand, tell you when to speak. So if you have questions, please raise your hand. You have the, is it the application or the reactions that can show us that you're raising your hand. If not, just raise your hand and we'll know. So we've got 5 minutes to do that. Faresi. Is anybody willing to ask a question? Okay, yeah, okay. Carol, thank you for joining. Yes, you've been unmuted. Okay. Oh, okay, I think someone has raised a hand before you. So please look for the reaction. Raise your hand so that you can be unmuted. Okay. Okay. Okay, can we hear your question, please? Okay, good afternoon, ma.
Good afternoon, how are you?
Go ahead with your question, please.
Okay, good afternoon.
We can hear you clearly. Thank you. Good afternoon.
Okay. Thank you. Good afternoon. Please, I want to know, after I finished my chemo, my final chemo 6 months ago, and I'm still having challenging with my center ear. Is there any problem about that? Thank you.
Sorry, I would like to know what kind of cancer was it you were treated for?
Breast cancer, stage 3.
Hello, ma'am. Okay.
Breast cancers.
Oh, okay.
Stage 3.
Oh, okay. The doctors are around.
Okay.
Okay, please can Dr. Ekusami or Dr. Ololade answer that question? Okay, Dr. Ekusami is on.
To the patient, what you have, you know you have alopecia. That is a hair loss secondary to the cancer treatment.
Yes.
So everybody, virtually, let me say, virtually everybody will recover their hair and even be thicker. But sometimes some patches may not come up. So you need to go back to your doctor. There are creams that can be given to you that will regrow your hair. Your primary doctor can do it. It doesn't have to be in the oncology office. Your hair will be back
Thank you very much.
There are medication. And let me say here, as a disclaimer, whatever advice we give here is just educational only. you have to see your doctor for specifics. Like, oh, this is what I had online. What is my situation? Because we do not know you inside out, okay?
Thank you.
Thank you very much, Doctor.
Thank you.
We have another person who has raised their hand. Carol. I think you can unmute yourself, Carol. Okay, you've been unmuted. We can't hear you. Hold on, we can't hear you. It's I don't know why it's such a problem to unmute you. It's a problem to unmute you here. Carol, please. Can you check if you can unmute yourself? Okay. I can't unmute you. Maybe you should type a message. I'm finding it really difficult to unmute you. Okay, anyone else wants to ask a question? Dr. Chika, would you want to respond to the first question?
Hi. Can you hear me?
Okay. Dr. Chika.
Yes, I'm on
We
now.
can hear you now.
All right. Well, I missed the question. I'm sorry. I'm actually on call. I'm trying to work, take hospital calls and do this at the same time. What was the first question? I can't hear.
She's been done with her chemotherapy. She has alopecia in the center of her head, and she said, that's what I'm trying to tell you. Can you hear me now?
Okay, say that again. What was the question? You keep cutting off. You keep cutting off. I can't hear you.
Yeah, I said the question is that she has alopecia. Oh. Okay, I'll send the question to your email. There's another person who is coming on board. Mobo Dushoga would like to ask a question. Mobo Dushoga, please can you answer your question?
I've actually sent the hi everyone. Good afternoon. From speaking from UK. I've sent the question to the email, or should I just you know bring it out here?
Yes, please.
Okay.
Say the questions here.
Right. Okay. Okay. I have a friend, my colleague, precisely, and he has been complaining about having a burning sensation towards his lower stomach, and then that burning sensation travel round down his thighs on both ways, and he also said that he wakes up maybe 2 or 3 times during the course of the night to go to the toilet, and this also happens during the day. So he goes frequently, although, I mean, because we do, as part of our routine, drink a lot of water, so we put it down to that. So could I have, any of the doctors to advise if this might be relating to, what we're discussing, or it's just something that he needs to go to his doctor and have it checked out? Thanks. Did you hear that?
I think Okay, good. Now, Carol.
Yes.
Carol, please, can you ask your question now? Go ahead, please. Go ahead, please.
Okay, sir. Go ahead. Let me carry it.
Hello. Yes. Can I go ahead? Yes. My question goes to any one of the doctors. We find that after treatment, let's say maybe you've been on treatment for 5 years, or you're done with your treatment and now you've got a good record of good health, you find that there are other illnesses that actually come upon the cancer survivors. Is this something that is common, or is it something that just comes out of nowhere? Can it be related with the cancer itself? Because there are other illnesses that come along that are similar.
Okay. Dr. Olalade, can you hear the question? Did you understand our question? Dr. Chika, did you hear our question? Dr. Chika, please.
All right. So your question was after your diagnosis with breast cancer, right? And then you have other illnesses,
Yeah.
whether there's a correlation between your breast cancer and the other illnesses? Is that what your question is?
Yeah. Yes.
Okay, so that question has various angles to look at it, okay? It will vary for person to person depending on your, what your risk factors, are you obese, what your predispositions from family dynamics, is there a history of diabetes, is there high blood pressure? So that question depends on you as, you know, as an individual. It's gonna vary. If you had a previous history of genetic history of high blood pressure, then you're still gonna have that with breast cancer. It doesn't have anything to do with the cancer. If you had a previous history of diabetes in your family, then you're still gonna have diabetes. The only thing is this, after breast cancer, they always encourage you to make sure you stay healthy, you avoid sugar, you avoid excess salt, and just stay proactive on your health, okay? Breast cancer in itself is not the reason for those other sicknesses, unless you had severe complications with your breast cancer, okay? If you had severe complications, then that's a different story. So like I said, everybody's gonna be different depending on what is particular to you. Did you hear what I said?
Thank you, Dr. Chika.
Oh, you're
Dr.
very
Olalade,
welcome. You're very welcome.
are you also? Dr. Olalade, can you throw light on the? Dr. Olalade, please can you respond to the gentleman's question? We can hear you now. Can you please respond to the gentleman's question?
Hello? Hello, can you hear me?
Yeah, we can hear you. Please go ahead.
Yes, please. For majority of those that have had cancers, the challenge is that because of the cancer and the battle of the chemo and as well as the treatment, the immunity would have dropped somewhat. So other conditions that normally would not be a challenge, that the immunity will be able to fight, will be because the limited immunity will predispose them to coming down with
Did that answer your question? Is that the question? Was I able to answer your question? Bobo, does that answer your question, please?
Sorry, I couldn't hear him. The audio was lost somewhere in his conversation or his response. I couldn't hear him, Tino.
So, okay, did it answer your question? Did the response answer your question?
I didn't hear any word of
okay.
this.
Okay, do you want to
yeah.
Okay, you ask your question again, please. Ask your question again because I don't think you responded to the question.
No, he didn't.
Please.
All right, will do. Let's check if everyone can hear me. Good afternoon, everyone. Okay.
Yeah, I can hear you.
Right. Okay. My question is.
Ask your question, please.
Okay. So my question is, I have a colleague who has been complaining for a couple of months now, I think. He's been complaining of a burning sensation towards its lower stomach, and this sensation travels around down to his inner thighs, and he also wakes up, you know, 2-3 times at night to go to the toilet. Also during the day, it goes to the toilet almost every hour or every other hour. So my question is this related to, you know, the topic of the day, or is just something that he needs to go to the hospital and have it checked out without having to worry that it can be related to cancer?
Hello? Hello? Yes, Dr. Already on the line. No. Apparently, what he complained of is... I can respond now. There are a couple of things that can account for that. It's looking somewhat like a digestive condition. I mean, that has to do with abdominal discomfort, and he's going to toilet every now and then. From things like HIV to things like malaria to things like abdominal discomfort to things like dysentery could account for this, or even a colonic cancer. So whenever we have a case like this, what we encourage people is that they should visit their GP. Their GP will look at them, examine them, do a few tests, check the digestive system, and whatever they now come up with, that will now determine how they proceed. They might even have to be scoped or something. They might have to have some sort of either proctoscope or some sort of endoscope done, or some sort of radiological investigation. Once that is done, then they will now be able to know how to proceed from there. Thank you.
Thank you.
Thank you, Lolade. Does that answer your question now, Bobo?
Yeah, I'll pass. Yeah, I'll pass it on. Thanks for that.
Does that answer your question now, Bobo?
Yes, it does.
Okay. Thank you very much. Now we'll be going on the next topic of today. We have people asking questions. Maybe I'll have to read them out. Okay. Okay, somebody is saying diet Please, can Renuka explain a little bit further what she meant by suffering consequences of hormone therapy after many years? I'm currently on hormone therapy.
Yeah, I just
like
typed
to know if
but it went elsewhere. Anyway, what I meant to say about that was that I was on tamoxifen for 5 years. Today, tamoxifen is being advocated for even longer than 5 years for those who are having the hormonal treatment. And it can have a lot of side effects. To some it does, to some it doesn't. Like for me, the basic thing that was initially were the hot flashes, which is quite disconcerting. You know, you're sitting in an air-conditioned room and suddenly you break out into a cold sweat and you really don't know what the hell that is about. You start getting panic attacks and you wonder that is it something to do with your heart or what the hell is it? Which over a period of time when you fan yourself a little extra and all, it goes away. But it's there and it stays with you. It continued that for a long time because I was not post-menopausal when I had been diagnosed for breast cancer and the surgery had happened. So my periods had to be controlled immediately. I mean, with the first chemo itself, there was a break off because my menopause had not yet taken place. And it was very dicey to let it continue according to the doctor, because it could affect, you know, my ovaries and all also later on. So that was one of the first effects. And the fact that the periods had stopped is what the doctor described. So that was one of the first effects. That was a good sign because that meant, yes, the medication is having its effect. That was one of the things which I dealt with. Now with the passing years and the age, I'm now 72 years. Now I've got over that phase. But yes, it troubled me a hell of a lot during the time when it was there. The second thing which I'm facing today is related with the osteoporosis. You know, the bone density loss that is there. That creates a lot of problems. And with me, this was one of the special problems which wasn't there so much then as it is now. I mean, I find I keep getting little aches and pains all over me because of this bone loss, density loss that's there. And every time I go for a bone densitometry test, yes, there is a bone loss. And that is attributed to this. The only way you can keep control on this is trying to have your normal dose of calcium supplements, which counter the effect to quite a great extent. But again, everything there's a dichotomy in everything. Because if you're having too much of that calcium intake, that calcification takes place in your various organs. So you can't even have that kind of a thing happening. So you have to be monitored for that with regular bone density. The other thing is the hypertension that comes in with all these tensions that are taking place. I won't attribute it 100% to hormonal therapy, but yes, it is there and it does create a big problem. So these are some of the 3 side effects that I'm facing with it. Diabetes is okay, a part of it. Doctors cannot attribute it to the tamoxifen, though I personally feel, yes, it is got something to do with it. I mean, there is no efficacy to that at all. So these are the things that when I said, which is the problem of chemotherapy.
Thank you very much, Renuka.
Thank you.
Thank you very much, Renuka. Now I have another question here. The person says, is one prone to other illnesses after cancer, even when you're having a good record of health? That's a question from someone. And then another one, I realized that most cancer survivors complain of pain on both feet, under both feet, most likely nerve issue or otherwise. Could this have been caused by the medications, chemotherapy, hormonal therapy, or radiation? I think this question is for the doctors now. So, Dr. Ekusami, would you be kind enough to answer that question? Did you get my question? And then Dr. Ololade too.
I did hear your question.
Yes, you're on, Dr. Ololade.
Yeah, what the question says, you said you asked two questions.
Is that
my soup and some Tabasco 9 ounces.
Yes, yes, yes. The first one says, is one prone to other illnesses, cancer treatment, after having good health record? That is one prone to illnesses. I guess what
yes.
he's trying to say is that can cancer make her contract other illnesses?
Yes. And the second question was about neuropathy. Now, yes, like Dr. Ololade said earlier, my colleague in Lagos said that especially immediately post chemotherapy and radiation and the cancer treatment, the immune system is reduced and patient may be prone to some infection. Some of them have neutropenia, some of them have pancytopenia, that means low blood count, low fighting cells, and they need to be very careful. But by and large, after several years, they should be back to where they were if they were doing what you said. That is, I remember you saying during your speech, you have to keep your health.
I remember you.
Can I continue talking? I hear an echo.
Please go on.
Okay. Now I
we
hear
can hear
you.
you. Go
I
ahead.
heard you say that you should keep your health. Yeah, especially cancer patients. You need to exercise. You need to eat very good food, healthy food. Do your routine checkup. And I had one of the ex-patient who said she had osteoporosis. Yes, even without cancer, without cancer treatment, you could have bone density that gets low once you pass menopause. So you need to do your bone density. If you are past 55, you need to take calcium and vitamin D. And it's even more important today. Most people are vitamin D deficient, and we need that in our body. So that is that. As far as the chemotherapy and radiation vis-a-vis neuropathy, numbness and tingling in the feet is common after a lot of chemotherapy, cisplatinum, taxanes, all those. Most chemo agents cause peripheral neuropathy. And there are medications we use to mitigate them. Sometimes we succeed largely, sometimes we don't. If you have problems, talk to your oncologist or your primary, your general practitioner, who could put you on things to mitigate against those neuropathy. The nerve gets damaged during this treatment sometimes, and it may be permanent, but sometimes we can mitigate it by giving you medication, gabapentin, Lyrica. Sometimes we even use bland agents. It doesn't treat the disease, but we can put you on lidoderm patch and lidoderm cream you can rub on your feet at night so you can sleep. This is the way to handle this. Thank you.
Thank you very much, Dr. Ekosami. Dr. Olalade, would you be kind enough to also throw light on numbness of the feet or the palm after chemotherapy?
I'm here. Mm. 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 Mm.
Hello, can you hear me now? Can you hear me now?
Yes.
Okay, thank you. I was asking Dr. Okay, good. Dr. Chika, please, can you put your light on that? Why there is numbness of palm and feet after chemotherapy?
So I didn't have chemotherapy. However, what I wanted to throw on it was just with the mastectomy, I still have, I think my biggest problem today is neuropathy. I have pain in my chest walls. I have pain to my left shoulder. I have pain to my back. I have been to the emergency room several times, and it was always diagnosed as neuropathic pain. And I'm on gabapentin, and so my light to it is, even if you don't have chemo, even if you don't have radiation, just the bare fact of that surgery, you will likely have neuropathic pain. And for me personally, that's my challenge till today. Some days are better than others, but and the gabapentin, like the doctor said, have been very, very helpful for me. It really helps with my pain. And like I said, my pain is all in my chest wall and my back. So whether you did chemo, radiation or not, just for the bare fact you had that surgery, things are not the same. Once you change things in a human being's body, it's no longer how it was. Things are out of place. You kill the nerves, sometimes referred pain. So that's a big challenge. That's a big challenge. So like he said, these are all advices. Consult your doctor, find out what's going on, because everybody's story is different. Your body is different, so that they can assess you and, diagnose and treat you based on what you're presenting with.
Accordingly.
Yeah.
Thank you so much, Dr. Chika.
Thank you.
Catherine, can you please throw some light on that? Did you have such symptoms like numbness of the palm and the feet? Or do you still have that?
Oh, okay. When I was undergoing chemo treatment, I remember getting. Can you hear me? Can you hear me?
I can hear you. Please go ahead.
Okay. Yeah. I remember it was getting all these funny pains. My feet, and I would be having these tingling feelings on my feet, and then when you're trying to sit, you're feeling all these pains, like there's a needle going through your bum as you're trying to sit. Yeah, you have, or I guess, I don't know. I guess it's with everybody. I mean, people who've had, like, especially breast cancer, if you've had all, your whole breast removed, the lymph nodes removed, and I still can't feel under my arm, I mean, my right side, that's where I had my operation. I can pinch myself as much as I want and I will never feel pain there. You can feel itchy and you're trying to scratch, but that itchiness isn't going through the skin. And yeah, there's the numbness, the hand. Because mine was on the right side, and I tend to use my right hand so much. And I'm lucky that I've not gotten lymphedema. That I really thank God for that. But there are all those, yeah, the funny pains that you get. You can even, like, I also become, I get cramps on the side of, my breast, because I had reconstruction done after a year. But you feel that, you get cramps and you're wondering, depending on how you're lying down. And also, like, when Renuka, the doctor has refused to remove me from tamoxifen. So I'm still on tamoxifen. I have learned how to live with those side effects, because I don't never think about the side effects. I decided they're not going to, I'm not going to sit and wonder, what next, when I'm taking the tamoxifen. So I know the only two major side effects I know is I had really put on so much weight. That was very, very worrying. And before I knew that the cause was tamoxifen. But now I've managed to control that, and with a lot of exercises and really eating properly, a proper balanced diet. You live with those hot flushes and you name it. Everybody here in the house is used to me, because I could be sitting here and almost wanting to undress, because of the heat. Yeah, but I guess you learn how to live with this, because it's part of my life now for the rest of my life. So I guess it's just embracing, trying to embrace side effects. What's happening to my body?
Trying to embrace side effects. Thank you very much, Catherine. I have another question here. The lady says, I would like to ask the doctors if chemotherapy treats cholangiocarcinoma effectively, as we have been told cholangiocarcinoma is not easily treated with it. And considering our age, 67, we might just... Dr. Lolade, do you want to talk to us about cholangiocarcinoma?
Yes,
Talk to us about cholangiocarcinoma, Dr. Lolade.
Now, cholangiocarcinoma, unfortunately, I lost my father to cholangiocarcinoma. So, so I'm really very passionate about that word. Anytime I hear cholangiocarcinoma, it startles me. Now, cholangiocarcinoma is a very challenging kind of lesion. There are a couple of things that, couple of strains and a couple of variants that it can have. There's one that it is the gallbladder, the gallbladder itself that it will be. Another one is that it's gallbladder, the biliary ducts itself will now have the carcinoma. The greatest challenge it has is that it causes a lot of obstruction of the common bile duct or at various levels. And once there's an obstruction of the bile duct, there's always the backflow of excess bilirubin into the system. So by the time, and because it's an innocuous location, by the time it comes up and it speaks, or you now notice the effects. It's already advanced, and there's already a lot of itch, and treatment to it is also very limited. and it's also very limited. And the kind of treatment is the response to chemotherapy is also pretty poor for cholangiocarcinoma. So as much as possible is one of the things that make malignancies really, 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 really sad. I mean, because the chances of recovery, if it's early, if it's picked early, the individual can have what we call the Whipple's procedure, where there's a form of bypass. But that is not often. It's a major surgery that is not often done. And the kinds of chemotherapy, as a matter of fact, most of the people will not respond very well to even chemotherapy or radiotherapy, or except it's surgery completely. So it's really one of the bad news of oncology. Thank you.
Thank you. Another question says, I had only 11 months ago. My left arm and side still aches. I am done with chemotherapy and radiotherapy. My worry is that I still notice a node in my affected armpit. Due to COVID holiday, did you hear that, Dr. Lolade?
Well, I heard that. I think the patient is saying that he saw a node. He saw a node after post treatment. What we'll advise such patients is that they should actually go back to the oncologist or to the treating physician. The treating physician will actually be able to either tell them to have a fine needle aspiration cytology of that lesion done, or they should actually, if it's something they have to do, a watchful waiting and see whether the lesion is just one of those that will be excised again, or one of those that will just be watched closely. That would examining the lesion would, after determining whether it's attached, whether it's immobile or something, whether it's attached either to overlying skin or to the underlying structure, will not take that will guide that decision making. And also some kind of chemotherapy that was taken, whether it was complete, whether they have to go for a second line or otherwise, or they have to stay with what they are currently on. Those are things that would guide that kind of decision making.
One more question before you go. Please, what are the treatment for lymphedema? She says she's got it since December, but she's doing exercises, wearing the hand sleeve.
Well, for lymphedema, the treatment options we normally have is they're really
the question is for you, Dr. Lolade.
For lymphedema, that's the swelling of the upper arm, I guess. The treatment. I'm here. I heard you. If it's the swelling of the arm. Hello. Hello. So concerning the swelling of the arm, the approach is that we use what we call the E45 cream to do a massage. We encourage them to leave the arm above the body particularly when they're above when they're sleeping. Yes, so I mean, so they can put that on. Lymphedema, yeah, the treatment pattern is what I'm mentioning, and they can wear the thick stockings. There's a pressure, like a pressure socks is what we call it, and after that has been done, that's basically how it is. But from experience, most of those that have had lymphedema, they have to just make up their mind to live with it. Only very few, 1 out of like 10, will actually restore and go back to the normal size. What we encourage people to do is that they just have, if they do not have challenges with their self-esteem, they can have to make use of wearing long sleeves and wearing long sleeve clothes and all that. But normally, if it's too early, you can make use of the pressure socks and all that, and that could also help. And raising the hand above the body, maybe putting a pillow beneath it.
Thank you so much, Dr. Lolade. So we'll quickly be moving on to the next topic, which is accessing medical cancer care at this period of COVID-19. Can you please share with us, Catherine, how it's been with your country, Kenya? I mean, during the COVID-19, how was you know, how cancer patients were getting their treatment, you know how easy it was for them?
Okay, at the moment, before when COVID started, there was all these issues of, you know, cancer patients not. Can you hear me?
Can you hear me now, Catherine?
Yeah, I have heard you. Yes, yes. Can you hear me? Can you hear me? You can. Okay. Here at the beginning, there were those issues of, you know, cancer patients allowed to go and seek see their doctors and all that. But now there was they've had meetings with the NCDs, the NCD, and all have had meetings. And yeah, cancer patients are being given priority at the moment, that you are able to go and see your doctor or seek